Does taking Ozempic for weight loss increase your risk of developing thyroid carcinoma? We're going to look into that today because it's a very controversial topic. A few months ago, I had made a video regarding the common side effects to the use of the semaglutides, which included Ozempic and Wegovy. And one of the complications was development of thyroid nodules that were malignant. A lot of people wrote back about that. Many said there's only a correlation if you're a lab rat, while others said, yes, I've been on Ozempic for 2 years and just diagnosed with cancer of the thyroid. This all stems from the initial studies where several of the lab rats developed a rare form of thyroid malignancy. That caused a black box warning. So it's listed not only in the package insert, but mentioned in all the commercials. We have a saying when it comes to laboratory studies: rats lie and monkeys die. That means that whatever happens in the animal population doesn't necessarily correlate to how a human's going to respond to the medication. Studies have been done which really don't show a correlation of Ozempic use to development of thyroid carcinomas. Recently, the International Journal of Molecular Science came out with an article where they took 15,000 individuals, half of them got Ozempic, half didn't. Of the Ozempic group, significantly less than 1% developed any type of thyroid malignancy. It wasn't zero, but it was fairly close. So they concluded that there really isn't a correlation between Ozempic and thyroid carcinoma. However, other studies have come up to approximately a 1% correlation. Now, it's a little murky because being morbidly obese increases your risk of developing thyroid cancer, and the morbidly obese are the ones taking this medication. So, is it the medication or is it the obesity? So, most of the studies were well under 1%. But it still is a problem because we're having 20 million prescriptions annually for this medication, which means if it's only 0.5%, you're still going to have 100,000 individuals develop cancer of the thyroid. So what should you do? Well, the correlation seems to be fairly low and not significant. But if you're on Ozempic, then it probably would pay to have your thyroid examined once or twice a year. And try to stay on the Ozempic for under 3 years because the 3-year mark showed a slightly increased incidence.